10 medications are most commonly associated with an increased risk of dementia. Did you know that some of the pills you take regularly might be affecting your cognitive health? Recent studies reveal that certain widely used medications could be linked to the development of dementia. Understanding the potential risks associated with these medications is crucial, as is exploring safer alternatives for treating conditions like anxiety, insomnia, depression, and chronic pain. This video delves into the top 10 medications that have a high association with dementia. It's essential to be informed about these risks to make better decisions regarding your health and medication choices. Each medication carries its unique risks and potential cognitive impacts. We'll guide you through the latest research findings and offer insights into safer treatment options. Make sure to watch until the end, as the last medication on our list is the most commonly linked to dementia, and many people take it without knowing the risks. Number 10. Hormonal contraceptives. Hormonal contraceptives, particularly those combining estrogen and progesterone, are widely used to prevent pregnancy and treat conditions such as menstrual irregularities and acne. While these medications are effective and convenient, there are increasing concerns about their impact on cognitive health, especially with prolonged use. Studies suggest that hormonal contraceptives can influence brain function in multiple ways. Sex hormones play a crucial role in neuroprotection and cognitive function, meaning that altering their levels can affect memory and other cognitive processes. Some research indicates that long-term use of hormonal contraceptives may be linked to an increased risk of cognitive decline and dementia. For instance, a study published in the Journal of Women's Health followed women who used hormonal contraceptives over extended periods and found an association between the use of these medications and a slight decrease in cognitive function. While the results are not definitive, they underscore the need for further research to fully understand the effects of hormonal contraceptives on the brain. If you are using hormonal contraceptives, it is important to discuss the potential risks with your healthcare provider. They can help evaluate whether these medications are the best option for you, taking into account your overall health and lifestyle. Alternatives for birth control include non-hormonal intrauterine devices, IUDs, barrier methods, or natural options, which may be less harmful to cognitive function. These alternatives can offer effective birth control without the hormonal impact on the brain. The decision to continue or adjust hormonal contraceptive therapy should be based on a careful evaluation of the risks and benefits for each individual. It's crucial to weigh the cognitive risks against the benefits that these contraceptives provide for reproductive and other health needs. Open communication with your doctor can help tailor a contraceptive strategy that aligns with your personal health goals and concerns. Awareness and informed decision-making are key to ensuring that your choice of contraceptive is not only effective but also supports your cognitive well-being in the long term. By staying informed and proactive, you can navigate your options confidently and choose the best approach for your health needs. Number 9. Statins. Statins, such as atorvastatin and simvastatin, are commonly prescribed to lower blood cholesterol levels and reduce the risk of cardiovascular diseases. They work by inhibiting an enzyme crucial for cholesterol production in the liver, thereby helping to decrease the likelihood of heart attacks and strokes. Despite their clear cardiovascular benefits, there is increasing concern about the effects of statins on cognitive health. Research on the relationship between statin use and cognitive function has yielded mixed results. Some studies suggest that statins might have a protective effect against dementia, possibly due to their role in reducing inflammation and improving blood flow to the brain. However, other studies indicate that statins could potentially increase the risk of cognitive problems. This may be because statins interfere with the synthesis of coenzyme Q10, a compound essential for energy production in brain cells, potentially leading to cognitive deterioration. A study published in the Journal of Lipid Research analyzed data from thousands of patients and identified a possible link between prolonged statin use and an increase in dementia cases. The researchers emphasized the need for further studies to thoroughly understand this relationship and to assess whether the cardiovascular benefits of statins outweigh the potential cognitive risks. If you are using statins, it is crucial to discuss these potential risks with your healthcare provider. They can help you evaluate the pros and cons of continuing or adjusting your statin therapy based on your individual health profile. There are alternatives for managing cholesterol levels, including dietary changes, physical exercise, and other medications that may have a less pronounced impact on cognitive health. When considering whether to continue or adjust statin therapy, a comprehensive evaluation of the risks and benefits should be conducted for each individual. Engaging in lifestyle changes, such as adopting a heart-healthy diet rich in fruits, vegetables, whole grains, and lean proteins, can also contribute to managing cholesterol levels. Regular physical activity is another effective strategy for maintaining cardiovascular health and potentially enhancing cognitive function. By staying informed and working closely with your doctor, you can make well-informed decisions about your treatment options. Balancing cardiovascular health with cognitive well-being is key, and your healthcare provider can guide you in choosing the most appropriate approach tailored to your needs. Number 8. Opioid painkillers. Opioid painkillers, including morphine and oxycodone, are frequently prescribed to manage severe pain, particularly after surgeries or in patients with chronic illnesses. These medications provide significant pain relief by binding to specific receptors in the brain and spinal cord, effectively acting on the central nervous system. However, beyond their pain-relieving properties, opioids come with substantial risks, including the potential for dependence and negative effects on cognitive health. Prolonged use of opioids has been linked to changes in brain structure and function, such as a reduction in gray matter volume in areas associated with memory and decision-making. These alterations can lead to cognitive problems and increase the risk of dementia over time. Additionally, the sedative effects of opioids can result in drowsiness and difficulty concentrating, further exacerbating cognitive issues. A study published in the Annals of Internal Medicine tracked patients who used opioids over extended periods and found a significant association between prolonged opioid use and an increased risk of dementia. The researchers emphasized the importance of carefully weighing the risks and benefits of opioids, particularly in elderly patients who may be more susceptible to adverse effects. If you are currently using opioid painkillers, it is crucial to discuss the potential risks with your healthcare provider. They can help you assess whether the benefits of continued opioid use outweigh the cognitive risks and explore alternative pain management strategies. There are several options available that may be less harmful to cognitive function, including non-pharmacological therapies, less potent medications, and interventional treatments. Non-pharmacological approaches, such as physical therapy, acupuncture, and cognitive behavioral therapy, can be effective in managing pain without the cognitive side effects associated with opioids. Less potent medications, like nonsteroidal anti-inflammatory drugs, NSAIDs, or acetaminophen, may also be viable alternatives for some patients. Ultimately, the decision to continue or adjust opioid therapy should be based on a comprehensive evaluation of the individual's specific needs and health circumstances. Collaborating closely with your doctor ensures that you can make informed decisions about your pain management plan, balancing effective pain relief with the preservation of cognitive health. By staying informed and exploring alternative therapies, patients can find a suitable approach to managing pain while minimizing potential cognitive risks. Number 7. Proton pump inhibitors, PPIs. Proton pump inhibitors, PPIs, such as omeprazole and esomeprazole, are commonly used to treat gastric issues like acid reflux and peptic ulcers. By reducing stomach acid production, these medications provide relief from symptoms and prevent damage to the esophagus and stomach lining. However, recent research has raised concerns about the potential impact of prolonged PPI use on cognitive health. Studies suggest that PPIs can interfere with the absorption of essential nutrients, including vitamin B12 and magnesium, which are crucial for maintaining healthy brain function. Deficiencies in these nutrients can lead to cognitive issues and increase the risk of developing dementia. Additionally, some researchers propose that PPIs might directly affect brain function, although the precise mechanisms remain unclear. A study published in JAMA Neurology analyzed data from thousands of elderly patients and found a notable association between long-term PPI use and an increased risk of dementia. The researchers emphasized the need for cautious use of these medications, especially among older adults, and highlighted the importance of considering less harmful alternatives when possible. If you use PPIs regularly, it is essential to discuss these potential risks with your healthcare provider. They can help assess whether the benefits of PPIs outweigh the risks for your specific situation and explore other treatment options. Alternatives for managing gastric problems include dietary changes, less potent antacids, and natural remedies, which can be effective without the cognitive risks associated with long-term PPI use. Number 6. Anti-epileptics. Anti-epileptic medications, such as phenytoin and valproic acid, play a crucial role in managing seizures for patients with epilepsy. By stabilizing electrical activity in the brain, these medications help prevent epileptic seizures and improve patients' quality of life. Despite their effectiveness in seizure control, prolonged use of anti-epileptics has raised concerns about their impact on cognitive health. Research has shown that long-term use of anti-epileptic drugs, AEDs, can lead to cognitive impairment. These medications affect brain function not only by stabilizing electrical activity but also by interfering with neurotransmitter function. This disruption can impair communication between brain cells, leading to memory problems and other cognitive issues. Additionally, the sedative effects of many AEDs can contribute to drowsiness and difficulty concentrating, which further exacerbates cognitive difficulties. A significant study published in the journal Neurology analyzed data from patients with epilepsy over several years. The researchers found a clear association between prolonged use of AEDs and cognitive decline, particularly in those taking high doses. Patients using these medications for extended periods were observed to have a significantly higher risk of developing dementia. The study underscored the need for careful management of AED therapy to balance seizure control with the risk of cognitive side effects. If you are on anti-epileptic medications, it is crucial to discuss these potential risks with your healthcare provider. They can help assess whether the benefits of continued AED use outweigh the cognitive risks in your specific case. New treatment options and combination therapies are emerging, which may offer similar efficacy in seizure control with potentially fewer cognitive side effects. Additionally, careful dose management can help minimize adverse effects while ensuring effective seizure management. Your doctor can guide you in evaluating alternative treatments and adjusting your current regimen to better protect cognitive health while maintaining adequate control of seizures. By staying informed and working closely with your healthcare team, you can make more informed decisions about your treatment plan and its impact on your overall. Number 5. H2 receptor blockers. H2 receptor blockers, such as ranitidine and famotidine, are commonly prescribed to manage gastric conditions, including acid reflux and peptic ulcers. These medications work by inhibiting the production of stomach acid, which helps alleviate symptoms of heartburn and prevents damage to the gastrointestinal tract. While effective for these purposes, recent research has raised concerns about their potential impact on cognitive health. Prolonged use of H2 receptor blockers has been linked to an increased risk of developing dementia. One of the primary concerns is that reducing stomach acid over long periods can interfere with the absorption of essential nutrients crucial for brain function, such as vitamin B12. A deficiency in these nutrients can adversely affect cognitive health. Moreover, some studies suggest that H2 receptor blockers might directly affect neurotransmitter systems in the brain, contributing to cognitive decline over time. A significant study published in the Journal of the American Geriatric Society examined over 1,000 elderly patients and found that those who used H2 receptor blockers regularly were at a markedly higher risk of developing dementia. This research highlights the potential risks associated with the long-term use of these medications, particularly in older populations. The findings suggest that healthcare providers should carefully monitor the use of H2 receptor blockers in elderly patients and consider alternative treatment options when appropriate. If you are using H2 receptor blockers, it's crucial to discuss these potential risks with your healthcare provider. There are other treatment options available for managing gastric conditions, such as proton pump inhibitors, PPIs, or lifestyle modifications, which might be effective without the same cognitive risks. Transitioning to these alternatives should be done under medical supervision to ensure continued effectiveness in managing your condition while minimizing potential side effects. Overall, staying informed about the risks associated with your medications and working closely with your healthcare provider can help you make more informed decisions about your treatment plan. This approach ensures that you address your medical needs while also safeguarding your cognitive health. Number 4. Antipsychotics. Antipsychotic medications, such as haloperidol and risperidone, are frequently prescribed to manage severe mental health disorders, including schizophrenia and bipolar disorder. These drugs are essential for altering the effects of neurotransmitters in the brain, helping to control symptoms like hallucinations, delusions, and severe mood swings. Despite their crucial role in treating these conditions, there is growing concern about their impact on cognitive health, particularly with prolonged use. Research has indicated that long-term use of antipsychotic medications may be linked to an increased risk of developing dementia. Studies suggest that these drugs can cause significant changes in brain structure and function, potentially leading to cognitive decline. For example, a study published in the British Medical Journal found that elderly patients treated with antipsychotics were at a heightened risk of developing dementia. The researchers observed that extended use of these medications accelerated cognitive symptoms, further complicating the management of mental health conditions. In addition to cognitive risks, antipsychotics are associated with a range of severe side effects, including excessive sedation, tremors, weight gain, and an increased risk of diabetes. These side effects can exacerbate the mental and physical health challenges faced by patients, making treatment more complex. Excessive sedation can impair daily functioning and quality of life, while metabolic changes from weight gain and diabetes add additional health concerns. For patients who require antipsychotic treatment, it is crucial to have thorough medical monitoring to track side effects and adjust dosages as needed. In some cases, healthcare providers may consider reducing the dose or switching to alternative medications that may have a lower impact on cognitive function. This careful approach helps balance the benefits of managing severe mental health symptoms with the potential risks to cognitive health. As we consider the implications of antipsychotic use, it's also important to explore other classes of medications that can affect mental health. Number 3. Tricyclic antidepressants. Tricyclic antidepressants, TCAs, including medications such as amitriptyline and imipramine, are commonly prescribed for managing depression and certain chronic pain conditions. These drugs function by increasing levels of neurotransmitters in the brain, such as serotonin and norepinephrine, which helps improve mood and alleviate pain. Despite their efficacy, tricyclic antidepressants come with a range of potential side effects, notably an increased risk of cognitive impairment. One of the key concerns with TCAs is their anticholinergic activity. Acetylcholine is a neurotransmitter essential for memory and learning. Tricyclic antidepressants can interfere with its normal function, leading to cognitive deterioration over time. Research supports this concern. A significant study conducted by Indiana University analyzed data from over 400,000 patients and found a clear link between prolonged use of TCAs and an increased risk of developing dementia. The study revealed that patients using these medications, particularly at high doses or over extended periods, faced a significantly higher likelihood of cognitive decline. The anticholinergic effects of TCAs are believed to contribute to these risks. By disrupting acetylcholine's function, these medications can impair memory and learning processes, which can gradually lead to more serious cognitive issues, including dementia. As a result, the long-term use of tricyclic antidepressants warrants careful consideration. If you are currently using tricyclic antidepressants, it is crucial to have an open discussion with your healthcare provider about the potential risks associated with these medications. There are alternative treatments for depression and chronic pain that may pose fewer risks to cognitive health. For instance, selective serotonin reuptake inhibitors, SSRIs, are a class of antidepressants with a lower anticholinergic profile and may be safer for some patients. Transitioning to SSRIs or other treatments should be done under medical supervision to ensure that your condition remains effectively managed while minimizing side effects. It is important to remember that both depression and chronic pain are serious conditions requiring appropriate management. Do not discontinue any prescribed medication without consulting your doctor. Work collaboratively to identify the safest and most effective treatment plan for your individual needs. Number 2. Anticholinergics. Anticholinergics are a class of medications widely used to manage various conditions, including allergies, urinary incontinence, Parkinson's disease, and common cold symptoms. Well-known examples include diphenhydramine, Benadryl, and oxybutynin. These drugs work by blocking the action of acetylcholine, a neurotransmitter crucial for cognitive and muscle functions. While they are effective for their intended purposes, prolonged use of anticholinergics has been linked to an increased risk of dementia. Acetylcholine plays a vital role in memory, learning, and overall brain function. By inhibiting this neurotransmitter, anticholinergics can impair cognitive processes over time. Studies have highlighted this risk, particularly in older adults who may be more susceptible to the cognitive effects of these medications. For instance, a comprehensive study conducted by the University of Washington tracked more than 3,400 adults over a period of 7 years. The research revealed that those who regularly used anticholinergics had a significantly higher risk of developing dementia. Specifically, individuals taking high doses of these medications for extended periods had a 54% higher risk of cognitive decline. The implications of these findings are particularly concerning given the widespread use of anticholinergics, including over-the-counter antihistamines. Many people may not be aware of the potential long-term risks associated with these common medications. This highlights the importance of informing patients, especially older adults, about the cognitive risks associated with anticholinergics and exploring safer alternatives. If you use anticholinergic medications regularly, it is crucial to have an open discussion with your healthcare provider about the potential risks. There are often less harmful alternatives available for managing the conditions treated by anticholinergics. For example, nasal corticosteroids can be an effective treatment for allergies without carrying the same cognitive risks. Switching to safer options should always be done under medical supervision to ensure that the treatment remains effective while minimizing potential side effects. The decision to adjust medication should be based on a thorough evaluation of the benefits and risks tailored to each individual's health needs. And now, we've reached the medication most commonly associated with an increased risk of dementia. Number 1. Benzodiazepines. Benzodiazepines, including well-known medications like diazepam and lorazepam, are commonly prescribed to manage anxiety, insomnia, and other stress-related disorders. These drugs work by enhancing the action of gamma-aminobutyric acid, GABA, a neurotransmitter that provides a calming effect on the central nervous system. While benzodiazepines can be highly effective in alleviating acute symptoms, their prolonged use is increasingly linked to significant cognitive health risks. Recent research has highlighted a troubling association between long-term benzodiazepine use and an increased risk of developing dementia. The mechanism behind this risk involves the way these medications alter brain function. By affecting neurotransmitter activity, benzodiazepines can impair memory and cognitive processes over time. Additionally, the potential for physical and psychological dependence complicates the situation, making it challenging for individuals to discontinue use without medical supervision. For instance, a comprehensive study conducted in France tracked over 1,000 elderly individuals for 15 years. The findings revealed that those who regularly used benzodiazepines had a 60% higher risk of developing dementia compared to those who did not use these medications. This data underscores the importance of critically assessing the use of benzodiazepines, particularly among the elderly, who are more susceptible to adverse effects. Given these risks, it is crucial for individuals using benzodiazepines to discuss these concerns with their healthcare providers. Alternative therapies, such as cognitive behavioral therapy, CBT, offer effective treatment options for anxiety and insomnia without the associated cognitive risks. Transitioning to these alternatives should be done carefully and under medical guidance to manage withdrawal symptoms and ensure continued treatment efficacy. Understanding the potential dangers of benzodiazepines emphasizes the need for vigilant medical oversight and the exploration of safer, non-pharmacological options for managing stress-related disorders. With this perspective, we can now turn our attention to another class of medications that also poses significant risks to cognitive health: anticholinergics. In conclusion, while medications are essential for managing various health conditions, their potential impact on cognitive health cannot be overlooked. Our exploration of drugs such as benzodiazepines, anticholinergics, and tricyclic antidepressants reveals a concerning association between long-term use and an increased risk of cognitive decline and dementia. Benzodiazepines, for instance, are effective in treating anxiety and insomnia but may significantly heighten the risk of developing dementia, particularly among the elderly. Anticholinergics, often used for allergies and Parkinson's disease, also pose a significant risk due to their impact on neurotransmitters critical for memory and learning. Tricyclic antidepressants, despite their benefits for depression and chronic pain, can contribute to cognitive impairment due to their anticholinergic properties. Given these risks, it is imperative for patients and healthcare providers to engage in open discussions about the potential cognitive effects of these medications. Exploring alternative treatments and therapies that mitigate these risks can lead to better long-term outcomes for cognitive health. Always consult with healthcare professionals to assess the benefits and risks of medications and to consider safer, effective alternatives tailored to individual health needs. Prioritizing cognitive health in medication management is crucial for maintaining overall well-being and quality of life. If you found this video useful, don't forget to like, share, and subscribe for more informative content. Your support helps us create more videos and keeps you updated on the latest health insights. Thanks for watching.